Test, test, test. Okay, we're good. Okay, this is chapter 7 on the skeletal system, and what we're going to do is talk about the components of the skeletal system, then the anatomy of the skeletal system, and its roles. Okay, so the skeleton is the body's framework. The soft tissues of the body hang onto the skeleton, which provides protection for internal organs, produces blood, acts as mineral storehouse, and allows movement in structures that are called joints. Okay, it is made up of structural connective tissue in the form of osseous tissue or bone, as well as cartilage. Okay, tendons and ligaments are connective tissue. Tendons attach muscle to bone, and ligaments attach bone to bone. And when we look at the functions of the skeletal system, we see that it supports the surrounding tissues, provides vital organs and soft tissues protection, is an area for movement at structures known as joints. It makes blood, and it stores mineral salts like phosphate and calcium and other components. Okay. Cartilage and osseous tissue make up the bulk of the skeletal system. Right? Cartilage is a structural connective tissue made up of chondrocytes, cartilage cells, embedded in lacunae and suspended in a semi-solid matrix. And it's found at the ends of bones and in joints, as well as in regions of long bones called epiphyseal plates, which persist until the end of puberty. Ligaments attach bone to bone, and tendons attach muscle to bone, and they're both made of dense, regular connective tissue, which we talked about in the tissue chapter. The formation of bone is called osteogenesis. Okay, and there's two types. There's endochondral ossification, and there's intramembranous ossification. Okay, a 3-month-old fetal skeleton is made almost entirely of cartilage. Ossification and growth begin after the cartilage model is fully formed, and eventually, by the time you pass through the birth canal, the remaining cartilage from which the bone was modeled on only persists at the epiphyseal plates and in the articular cartilage, and in joints that are joined by cartilage, which are called amphiarthroses for their range of movement, or cartilaginous joints for the material that holds them together. Okay, those are functional and structural classification. Longitudinal bone growth continues till the end of puberty, which is around 15 for girls and 16 for boys. And bones mature until about 21 years of age. And after that point, we actually begin to lose bone mass, okay, all the way until we die. Okay, so bone density generally peaks at the end of puberty, okay, and longitudinal bone growth stops at the end of puberty, and then bone density begins to decline slowly from middle age until death. Okay, so when we talk about ossification, we're talking about two processes. Let's take a look at those now.
Bone formation, also known as osteogenesis or ossification, is the process by which bone tissue replaces embryonic connective tissue to form the skeleton. From childhood to early adulthood, ossification lengthens and thickens bone. In addition, the process of ossification is used throughout life to remodel bones. There are two methods of prenatal bone formation. During intramembranous ossification, bone is generated on or within fibrous connective tissue membranes. As the process begins, mesenchymal cells differentiate into osteoblasts in regions called ossification centers. The osteoblasts secrete osteoid or uncalcified bone matrix. Over a few days, osteoblasts become osteocytes, and calcium and other mineral salts are laid down, hardening the matrix. The bone matrix develops thin columns of bone called trabeculae, which fuse to form spongy bone. Blood and lymphatic vessels grow into the surfaces of the newly formed bone and develop red bone marrow. Outside of the bone, a dense layer of connective tissue called the periosteum forms. Most outer layers of spongy bone are eventually replaced by compact bone, but the center remains spongy. Intramembranous ossification also occurs with skull bones in childhood. At birth, skull bones are separated by fontanelles, or soft spots, and sutures, immovable joints made of fibrous tissue. Fontanelles in the fetal skull allow for easier passage through the birth canal and rapid brain development. Up until adolescence, the fontanelles slowly ossify into sutures, providing the brain with greater protection. Endochondral ossification, the replacement of cartilage by bone, occurs in most bones of the skeleton. The process begins when embryonic mesenchyme condenses, forming the cartilage model, the shape of the future bone. The model grows within the fetus. Lengthwise growth is attained via interstitial growth. Width is attained via appositional growth. A nutrient artery penetrates the perichondrium, increasing nutrient availability to the cells. Osteogenic cells are stimulated to differentiate into osteoblasts. These cells secrete matrix beneath the perichondrium that forms a thin shell of compact bone known as the bone collar. As the perichondrium begins to form bone, it is now called the periosteum. The bone collar reduces diffusion to the cartilage inside the model, depriving it of nutrients. Capillaries grow into the disintegrating cartilage, delivering osteoblasts. The new growth forms a primary ossification center, an area where bone tissue will replace most of the cartilage. Osteoblasts deposit bone matrix, building spongy bone trabeculae. The growing model is gradually remodeled. The cavity fills with capillaries and red bone marrow. Ossification proceeds, forming the main portion of a bone, known as the diaphysis. Around the time of birth, blood vessels enter the epiphyses, the ends of a bone, forming secondary ossification centers. Secondary ossification differs in that no medullary cavity forms, and ossification proceeds outward. As a result, the interior of the epiphysis remains spongy. Secondary ossification leaves a thin layer of hyaline cartilage covering the epiphyses. This is known as articular cartilage, and it reduces the friction and shock in bone joints. The change to the epiphysis also forms the epiphyseal plate, a layer of hyaline cartilage that enables the diaphysis to grow in length.
Supporting connective tissue can be subdivided into cartilage and bone. Cartilage has a semi-solid extracellular matrix that allows flexibility, whereas the solid matrix of bone is more rigid and provides greater support. There are three types of cartilage: hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage is the most common type. It is found on the articular surfaces of synovial joints. It also forms the cartilage of the larynx, trachea, and nose. Chondrocytes, or mature cartilage cells, are found within small spaces called lacunae that are scattered irregularly in the extracellular matrix. Collagen fibrils are present within the matrix but not visible in the light microscope. A perichondrium, a dense irregular connective tissue sheath, overlies most cartilage. Elastic cartilage is found in the external ear and in the epiglottis. It contains abundant elastic fibers, which form a web-like mesh around lacunae that contain chondrocytes. Like hyaline cartilage, elastic cartilage usually has a perichondrium. Fibrocartilage is found in intervertebral discs, the pubic symphysis, and the menisci of the knee joint. It contains numerous irregular bundles of collagen fibers. The sparse ground substance contains chondrocytes within lacunae that are frequently arranged in parallel rows. Unlike hyaline and elastic cartilage, fibrocartilage does not have a perichondrium. There are two forms of bone or osseous connective tissue: compact bone and spongy bone. Compact bone usually forms the hard outer shell of bones. Concentric rings of bone, called lamellae, form cylindrical structures known as osteons. Each osteon has a central canal that connects to a network of tiny branching passageways called canaliculi. The central canal and canaliculi contain blood vessels. Osteocytes, or mature bone cells, occupy lacunae, small spaces, between neighboring lamellae. Spongy bone, also known as cancellous bone, usually forms inside of bones. It does not contain osteons. Slender bony plates, called trabeculae, form a bony network. The spaces between trabeculae contain bone marrow and blood vessels. Osteocytes are scattered throughout the trabeculae. The combination of compact and spongy bone allows bones to be both strong and lightweight.
The human skull is made up of 8 cranial bones that surround and protect the brain, and 14 facial bones that form the underlying structure of the face and support for the teeth. With the exception of the mandible, the bones of the skull articulate with each other through joints known as sutures. Throughout the skull, holes known as foramina serve as passageways for blood vessels and nerves. Bones on the surface of the skull encase the brain, protect sensory organs, and serve as attachment sites for the muscles of the head and neck. These bones include the occipital bone, parietal bones, temporal bones, and the frontal bone, as well as the nasal bones, the zygomatic bones, the maxilla, and the mandible. Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and 2 pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. The 2 L-shaped palatine bones form the posterior third of the hard palate, part of the nasal cavity, and a portion of the orbit. The small, thin lacrimal bones make up the anterior portion of the medial wall of each orbit. A groove known as the lacrimal groove helps to form the nasolacrimal canal, which contains a duct that allows tears to travel to the nasal cavity. The vomer is an elongated, plow-shaped bone that forms the inferior and posterior part of the nasal septum. The internal and external skull bones articulate precisely, forming an intricate structure perfectly suited to its functions.
When we talk about the histology of bone, we're talking about what it looks like in terms of a tissue. Okay, there's two types of bone. There is compact and spongy bone. The structural unit of compact bone is the osteon, and it's made up of concentric lamellae with lacunae containing osteocytes that are connected by canaliculi, through which cytoplasmic extensions join the osteocytes together so that they can exchange nutrients and oxygen and get rid of waste products until we get to cells that are near the blood supply. Okay. All right. Osteocytes are the same, but the arrangement of the blood supply is different in spongy versus compact bone. Cancellous bone has red bone marrow. Okay. The Haversian canal is running through the center of the osteon with concentric lamellae around it. These concentric rings of bone are made up of protein and calcium phosphate called hydroxyapatite. Most of the protein is collagen, which resists twisting and torsion. The lacunae, or the pits embedded in the osseous tissue that contain the osteocytes, and they're connected by the channels called canaliculi that allow the osteocytes to communicate with each other. Okay. In cancellous bone, we have a meshwork of bone with a spongy appearance that's created by trabeculae. Bone marrow fills the spaces between the trabeculae, and in the ends of the proximal heads of the long bone and in the axial skeleton, which is the skull, the rib cage, the sternum, the sacrum, and the coccyx, and the vertebral column, we have red bone marrow that produces blood in a process called hematopoiesis. Okay? So that is the source of blood when blood wears out, right? Red blood cells last 120 days in circulation before they have to be replaced because of the damage they experience as they pass through capillaries. The pelvic girdle is also a source of hematopoietic tissue. This is often where they take a red marrow sample if you donate. Okay. Yellow marrow is found in the medullary cavities of long bones of adults. Okay, and so what happens there is that initially what was red marrow gets converted to yellow marrow, and that serves then as fat storage. Okay. What we want to look at next is sort of what this tissue looks like. We can classify bones based on their shape. Okay. Long bones are longer than they are wide or deep. Examples include the humerus, the radius, the ulna, the femur. Flat bones are not perfectly flat, but they're basically flat. They have a layer of compact, then spongy, then compact bone underneath. Examples include the frontal bone, which makes up the forehead of the skull, the parietal bone behind it, the occipital bone, the sternum, okay, the scapula, all examples of flat bones. Irregular bones have unusual shapes, like vertebrae or the coxal bones of the hip, okay? And then short bones are basically cube-shaped, and examples include the carpals and the tarsals, and the patella would be an example. Okay? So, in a long bone, there are ends called epiphyses, a shaft called the diaphysis, and a region that adjoins the heads to the shaft called the metaphysis, which widens into the epiphysis. There are two epiphyses in a typical long bone, the proximal epiphysis, closest to the trunk, and the distal epiphysis, which is furthest from the trunk. Okay, so you're showing here a femur. The proximal epiphysis would be here. That's the part that fits into the socket in the hip bone called the acetabulum. The distal epiphysis would be here. That's the part that sits on top of the tibia, which is the medial bone of the lower leg. Okay. The medullary cavity in the adult contains yellow marrow. Okay. And you can see that there is a layer of compact bone, spongy bone beneath that, and then a medullary cavity present only in the diaphysis. And then a membrane called the periosteum, and that's where bone cells come from, including the osteoclasts and the osteoblasts. The osteoblasts build the bone, and osteoclasts tear the bone up. And then there's an endosteum that lines the medullary cavity and does the same thing. Okay? The periosteum is also a source of blood supply for the bone. The bone usually has a single nutrient artery that branches extensively throughout the compact bone and also supplies blood to the spongy bone, and that allows it to grow continuously. A broken bone heals in 6 to 8 weeks because of the extensive blood supply. Okay? Remember that bone, like cartilage, is structural connective tissue. Okay? Short bones are not merely shorter versions of long bones. They don't have a long axis and they have an irregular shape. Carpals and tarsals are examples, while flat bones are thin bones that are found wherever the need for extensive muscle attachment is present. They usually have some curvature to them. Again, examples: the sternum, the bones of the cranium, the scapula are just a few examples. Okay? Irregular bones have unusual shapes. Examples include the vertebrae and the os coxa, which are the bones of the pelvic girdle. Spongy bone is generally surrounded by compact bone on the superficial aspect, right? And then in the epiphyses of long bones, it is making up the remaining volume of the epiphysis. In the shaft of the long bone, it is on top of the medullary cavity. But in flat bones and irregular and short bones, it's basically compact bone with spongy bone on the inside. Sesamoid bones are small rounded bones enclosed in a tendon and fascial tissue and located near joints. An example would be the kneecap or patella. Okay? Now, bone markings are important because they provide for us a way to determine where muscles attach, where ligaments attach, and where blood vessels and nerves pass through the bone. Because this is why we learn them. Okay? Processes are projections from the surface of bone. Fossa is a depression in the surface of a bone. These are important in muscle attachment, as passageways, and as articulations. Okay? Examples include spines, condyles, tubercles, trochleas, trochanters, crests, lines, heads, and necks. Okay? What are each of these? A spine is a ridge along the surface of a bone. A condyle is a knuckle-like smooth projection on a bone that generally participates in a joint. A tubercle is a projection, a small projection from the surface of a bone that's usually a place for tendon attachment. A trochlea is a rounded projection at the end of a bone. It's found in one place, which is at the end of the humerus, which is the bone of the upper arm, and it fits into a socket called the trochlear notch and forms the elbow joint. Okay, and it's covered in cartilage. A trochanter is an enhanced projection from the surface of a bone that large muscles attach to. Examples of trochanters are found on the proximal femur near the hip, and they include the greater and the lesser trochanter. Okay? A crest is a ridge along an edge of a bone. A line is a ridge on an internal surface of a bone. Okay. A head is an end of a bone, right? That's usually found at the end of the epiphysis. Okay. And then the neck is going to join the head to the rest of the long bone. Okay. Fosses are depressions. Other features include sutures, which are puzzle piece-like interconnections between bones that are usually held together by fibrous connective tissue and don't move. A foramen is simply a hole in a bone. A meatus is a long passageway through a bone. A sinus is a hollow chamber inside a bone. Okay? And a sulcus is an indentation on the surface of a bone. Okay? The divisions of the skeleton include the axial skeleton, which is the skull, the hyoid bone, the vertebral column, the sacrum, the coccyx, the ribs, and the sternum. Okay? And then the appendicular skeleton, which is made up of the pectoral and the pelvic girdle and the bones of the arms, the legs, the hands, and the feet. Okay? So we'll look at each of these. All right? The axial skeleton is made up of the frontal and parietal bones, the occipital bone, the temporal and sphenoid bones, the ethmoid bone, and the auditory ossicles. The facial bones include the nasal and palatine bones, the maxillary bones, the zygomatic bones, the lacrimal bones, and the inferior nasal conchae. And then finally the vomer and the mandible. Okay? So we'll look at how these fit together next. So you can see the bones of the skull here in sagittal view. Okay? Frontal in blue, parietal in yellow, temporal in blue, zygomatic in purple, maxilla in blue, mandible, the only movable bone of the skull, in tan. Okay? And then you've got the lacrimal bone here in the medial orbit, the ethmoid bone behind that, and in the very back of the orbit there's the sphenoid bone, and the bridge of the nose is the nasal bone right here. Okay? And then and the sphenoid bone is also here. All right? And then if we move to a frontal view, okay, you can see nasal bone here, inferior nasal conchae down here, all right, sphenoid bone in the back of the orbit, zygomatic bone is the cheek, maxilla is the upper jaw, mandible, lower jaw, and then you've got the ethmoid bone here, which forms the upper nasal septum, the middle and superior nasal conchae on the edges, the lateral edges of the nasal cavity, and the nasal bone, which is the bridge of the nose. Okay, frontal bone, the forehead, temporal bone back here. Okay, and then mandible down here. Again, the only movable bone of the skull. Okay, orbits are cavities that enclose and protect the eyes. The roof of the orbit is made up of the frontal and sphenoid bone. The floor of the orbit, the maxilla and zygomatic bone. The lateral wall of the orbit, the zygomatic and the greater wing of the sphenoid. The medial wall, the maxilla, the lacrimal, and the ethmoid bone. Okay. The nose framework surrounds the two nasal cavity. The roof is made up of the ethmoid bone. The floor, the maxilla and palatine bone. The lateral wall, the maxilla and the palatine bone. Palatine bone makes up the back third of the hard palate, the upper jaw. Okay. The septum of the medial wall, made up of the ethmoid bone on the top of the nasal septum, the vomer on the bottom, and the nasal bone, which makes up the bridge of the nose, as well as portions of the septum. Okay. The foramina of the skull are passageways for blood vessels and nerves. The foramen magnum is where the spinal cord meets the brainstem. Very important. Large hole. That's literally what foramen magnum means. Hole, large. Okay. The hyoid bone doesn't articulate with any other bone and is suspended by ligaments from the styloid processes, which you can see in the picture below, and supports the tongue. Okay. So let's look at the act.
1. The skeletal system.
Now that you've learned a few basic anatomical terms, you're prepared to boldly explore one of the most important bodily systems, the durable, yet unexpectedly sensitive, skeletal system.
The skeletal system is a vast and a complex system that is home to more than 206 bones as well as cartilage. Cartilage is the bendable stuff found at the end of your nose, among other places. This bone and cartilage combo makes up 20% of the total mass of the human body.
The skeletal system is designed to protect and support. That's its job, and it does it well.
The skeletal system as a whole can be broken down into two major divisions, the axial division and the appendicular division. The first part we'll look at is the axial division.
Section A, the mighty axial skeleton.
And now, an amusing fact from everybody's favorite anatomical educator, Slim Goodbody.
Did you know that the word skeleton comes from a Greek word meaning dried up body? Dried up bodies are fun!
The axial skeleton is composed of 80 bones and forms the long axis of the body that we mentioned before. This includes three major regions: the skull, the vertebral column, and the bony thorax.
Now, the axial division has an important job, namely supporting the head, neck, and torso, as well as protecting the brain, spinal cord, heart, and lungs. Without it, we'd be a gelatinous lump, unable to protect ourselves.
All right, maybe that's not true, but I'll tell you what is true. The skull is the most complex part of the axial skeleton, and also what we're looking at first. But before we do, it's probably a good idea for you to learn a few anatomical terms to help you understand the descriptions of bones in the axial skeleton. Two important terms to know are the terms paired and articulates.
The term paired usually means that a bone is paired with a copy of itself. In poker, you can have a pair of aces. In the skeletal system, you can have a pair of bones. For example, the temporal bones, two bones that help make up the sides of your skull, are paired bones. Obviously, the opposite of paired is unpaired. That's a bone that doesn't have a match.
The phrase articulates with is another way of saying connects with. So, for example, the radius and the ulna are two bones in your forearm that we'll talk about later. Both of these bones are connected to the humerus, a bone in your arm. So both the radius and the ulna articulate with the humerus.
So, if one bone articulates with another bone, it's connected to it. Got it?
Ask me in an hour.
Will do. Let's move on to the skull.
Region 1, the skull.
The skull is made up of 22 different bones, not including the 3 tiny bones in each ear. The bones of the skull are divided into 2 sets, the cranial bones, or the bones of the cranium, and the facial bones.
The bones in the cranium.
The cranium is unbelievably important because it protects the ears and the brain like a bony helmet. It also serves as a point of attachment for muscles in the head that we'll discuss later.
The cranium contains 8 bones. 2 of them are paired and 4 of them unpaired. The 2 paired bones are the parietal and the temporal. That's 4 bones total. The 4 swing-in single bones are the frontal bone, the occipital bone, the ethmoid bone, and the sphenoid bone.
Altogether, that's 8 bones, and yes, you have to know them all. Thus, the memorization begins.
The frontal bone is the bone that forms the forehead and part of the eye sockets, or as smart people say, the superior orbits. The frontal bone also contains the paranasal sinuses, the mucus-lined cavities that warm up and filter air as we breathe it. If you're confused, don't worry. We'll give you more detail on the sinuses a little later on.
The paired parietal bones form the upper sides, or simply put, the roof of your cranium. The occipital bone forms the posterior base of the skull, at the back of your head. And let's not forget the paired temporal bones. These bones form the inferior lateral sides of the skull at your temples, just over your ears and below the parietal bones. Remember, inferior means lower, and lateral means outer side of. So the temporal form the lower, outer side of your cranium.
There are also 2 bones found at the anterior base of the cranium. These are the ethmoid bone and the sphenoid bone.
The ethmoid bone helps form the nasal cavity and the nasal septum, a wall that separates the cavity into right and left sides.
Don't worry,
We'll go into more detail on the nasal cavity in a little bit.
The sphenoid bone is located at the anterior or front part of the cranium's base. The sphenoid bone articulates or connects with all other cranial bones. Because of this, the sphenoid bone is sometimes called the keystone of the cranium.
One way to help remember the names of these bones is by breaking them up into ols and oids. The oid bones, ethmoid and sphenoid, are internal bones of the cranium. The ol bones, frontal, parietal, occipital, temporal, are all external cranial bones. Get it?
Yeah, time for nakedness. Woo!
Sorry, nakedness will have to wait until we finish talking about facial bones.
There are 14 beautiful, beautiful facial bones. 6 of them are paired and 2 of them are unpaired, for a grand total of 14 facial bones.
The facial bones are the unpaired mandible, the paired maxillae, the paired zygomatic bones, the paired nasal bones, the paired lacrimal bones, the paired palatine bones, the paired inferior nasal conchae, and the unpaired vomer.
These wonderful bones are directly connected to the facial muscles, which we'll talk about later. Those fantabulous facial bones also provide cavities for the facial organs, like the eyes, nose, and tongue. But it doesn't stop there. The facial bones also anchor the teeth and even serve as pathways for air and food.
One of the most important facial bones is the mandible. The mandible forms the lower jaw and anchors the bottom teeth. It's the largest and strongest of all the facial bones.
Now, it's true the mandible is strong and works well for George Clooney and Jay Leno, but the paired maxillae are important facial bones.
The paired maxillae anchor the upper teeth and form the upper jaw. They also form the anterior or front part of the hard palate. In everyday life, the hard palate is known as the roof of the mouth, but it doesn't stop there. The paired maxillae also form the inferior orbits. That's the lower part of the eye sockets. They even help form the nasal cavity.
Other important facial bones are the paired zygomatic bones. These bones are the ones that form the cheekbones. Then there's the paired nasal bones. Without these babies, there'd be no bridge to your nose. And let's not forget the paired lacrimal bones. The lacrimal bones form the anterior medial orbits, which are part of the eye socket and, sadly enough, contain the lacrimal, or tear sacs.
Another important pair of facial bones are the palatine bones. You remember earlier when we said that the paired maxilla make up the hard palate? Well, they don't do it alone.
The paired palatine bones make up the posterior hard palate. That's the back part of the palate. The paired palatine bones also make up a small part of the floor of the orbits, or eye sockets. And finally, they help make up our friend the nasal cavity. That's inside your nose in case you've forgotten.
And then there's the unpaired vomer, yet another important facial bone.
The vomer forms the posterior and inferior parts of the nasal septum. That's the back lower part of the little wall that divides the inside of your nose.
Finally, there's the paired inferior or lower nasal conchae. The paired nasal conchae make up the lateral or side walls of the nasal cavities. You got it? Now might be a good time to rewind the tape and review what you've just learned.
Oh, right, the hyoid bone. There's also a hyoid bone, which isn't officially part of the skull, but is often discussed at the same time.
The hyoid bone is a small horseshoe-shaped bone. It's located inferior to, or below, the mandible, and it's superior to the larynx, or voice box, in the anterior neck. Whew, that was a mouthful. The hyoid bone serves as a point of attachment for a bunch of neck and tongue muscles. It also acts as a movable base for the tongue.
The hyoid bone is a unique, almost sad bone. It's the only bone that doesn't connect directly with any other bone in the body.
Region 2, the vertebral column.
The vertebral column, or as it is known in dumb guy circles, the spine, consists of 26 different bones called vertebrae. The vertebrae are separated by pads of fibrous cartilage called intervertebral discs, which absorb pressure and allow for maximum flexibility. The vertebrae are held together and stabilized by types of connective tissue called ligaments and tendons. Ligaments attach bones to bones, and tendons attach bones to muscles. But don't worry, we'll elaborate on tendons and ligaments in a bit. The vertebral column houses and protects the spinal cord, another structure we'll give you the details on later.
And now, another amusing fact from the man with the anatomical plan, Slim Goodbody.
Did you know that the adult spine is 28 inches long and if ripped out can be played like a glockenspiel? Glockenspiels are fun!
The vertebral column is separated into 5 different divisions. They are the cervical division, the thoracic division, the lumbar division, the sacral division, and the coccygeal division.
The cervical division contains 7 small vertebrae which are located in the neck. The thoracic division contains 12 vertebrae which are located in the torso. These vertebrae articulate or connect with the ribs. The lumbar division contains 5 vertebrae which are located in the lower back.
To remember the number of vertebrae in these first 3 sections, think of the times most normal people eat breakfast, lunch, and dinner, 7 a.m., noon, and 5 p.m. Think of the cervical division as the breakfast division, with 7 vertebrae. The thoracic is lunch with 12, and the lumbar is dinner with 5 vertebrae. Pretty helpful, huh?
Okay, the sacral division or the sacrum contains 5 vertebrae. These vertebrae are fused or melded together into one big vertebrae in adults. It's inferior to or below the lumbar vertebrae. The coccyx, located inferior to the sacrum, contains 3 fused vertebrae. It is sometimes called the tailbone.
The vertebral column also contains 4 curvatures which give it an S shape and a super spring-like flexibility.
The top curvature in the vertebral column is called the cervical curvature. This curvature is concave posteriorly, meaning it caves inward like a spoon. It is located in what we call the neck. The thoracic curvature is convex posteriorly, meaning it bulges outward like an eyeglass lens. This curvature is located in the upper backbone. The lumbar curvature is also concave posteriorly, but this curve isn't formed until we begin to walk upright. This curvature marks the lower backbone. And finally, the sacral curvature is convex posteriorly.
These curvatures give our spines an attractive S shape that men and women adore both at home and abroad. But as with all things good, curvatures have a downside, namely curvature abnormalities.
Curvature abnormalities can be blamed on any number of factors. Some are congenital, which means they were present before birth. Some are even caused by bad posture. There are few common curvature abnormalities, like scoliosis, kyphosis, and lordosis.
Scoliosis, for instance, is an abnormal curvature that usually occurs in the thoracic region of the spine. That's the second region that forms the upper backbone. For some unknown reason, scoliosis is more common in girls and can sometimes be caused by having lower limbs of unequal length. Scoliosis can sometimes be treated surgically or with a body brace. Kyphosis is an extreme thoracic curvature, creating a condition known as hunchback and inspiring lackluster animated films. You can get this disease from rickets and tuberculosis of the spine. Lordosis is an extreme lumbar curvature and is commonly referred to as swayback. Lordosis sometimes affects pregnant women and individuals with potbellies. This is because people with potbellies have a tendency to thrust their abdomens forward.
Well, that's the vertebral column and all of its trappings. We've also discussed the skull. That leads us to the final part of the axial skeleton, the bony thorax. Now, the bony thorax may sound like a mythological...
I am the bony thorax. Beware the vengeance of the false ribs. You must
You're
go...
not the bony thorax. You're just a guy in a cloak.
Am I? Or is your mind numb with fear?
Well, don't I feel foolish?
Region 3, the bony thorax.
The bony thorax, or the thoracic rib cage, protects the heart and the lungs. It serves as a point of attachment for the neck, head, back, chest, and shoulder muscles. The bony thorax is made up of 3 parts. They are the 12 thoracic vertebrae, the sternum, and the ribs.
The thoracic vertebrae form the posterior midline of the rib cage. That means they divide the rib cage in half from the backside. The sternum, or the breastbone, forms the anterior midline of the cage. It's easy to find the sternum. It's the hard plate right in the middle of your chest. And finally, the ribs are 12 paired flat bones that form the lateral or side bars of the cage. That means altogether there's 24 ribs. The ribs are all directly attached to the thoracic vertebrae, but not the sternum.
The first 7 ribs are called the true ribs. The true ribs are attached anteriorly to the sternum by hyaline cartilage, a special type of cartilage, and they are, of course, as stalwart and honest as Abe Lincoln. The last 5 ribs are known as false ribs. The false ribs are indirectly attached to the sternum by cartilage located directly above them. They are also as wily and dishonest as the pickpockets from the musical Oliver. The last 2 false ribs are sometimes called floating ribs because they have no attachment, physical or emotional, to the sternum. Instead, they are attached to muscles in the lateral wall of the body.
And remember, the ribs are paired bones, so there's 24 altogether.
Well, that about sums it up for all 3 parts of the axial skeleton: the skull, vertebral column, and the bony thorax. And if you can't remember all the names and characteristics of the bones we've discussed, feel free to fail your test. Oh, I'm sorry. I didn't mean to say that. Feel free to rewind the tape and review at your own pace. But brace your...
With the torso or trunk, we have the vertebral column, which is broken up into 3 divisions: the 7 cervical vertebrae, followed by the 12 thoracic, which articulate with ribs, and the 5 lumbar vertebrae. L5 lies right above the sacrum, which lies right above the coccyx, which at one point during development used to be your tail. Okay? The thorax, or the rib cage, is made up of the sternum, costal cartilages, ribs, bodies of thoracic vertebrae, and it closes and protects the heart and the lungs. And you can see here the rib cage pictured. Okay? The sternum is made up of 3 parts: the manubrium, the body, and the xiphoid process. You have a total of 7 true ribs: 1, 2, 3, 4, 5, 6, 7. 5 false ribs below that: 1, 2, 3, 4, 5. The 2 floaters are the last of the false ribs. Okay, and then you've got, of course, the thoracic vertebrae making up the back of the rib cage. Okay, they articulate laterally with each of the ribs. Okay, the manubrium is going to form a joint, a saddle joint with the clavicle, your collarbone. Okay, and resting against, of course, the back of the rib cage are your shoulder blades or scapula. Okay, and that articulates with the lateral side of the collarbone to form a portion of the shoulder socket. Okay, the breastbone, made up of its 3 parts: the manubrium, the body, and the xiphoid process. There's also an attachment point for the diaphragm and the rectus abdominis muscles, which compress the abdominal organs internally in a maneuver known as the Valsalva maneuver that helps us to defecate and give birth, for instance. Okay. The ribs are attached posteriorly to the thoracic vertebrae, and anteriorly the first 7 ribs articulate or touch cartilage, which in turn touches the sternum, and then the next 5 pair are going to touch cartilage that touches other cartilage that touches the sternum. Okay, those are the first 3 false ribs, and then the last 2, the floating ribs, do not articulate or touch the sternum at all. Okay.
While the axial skeleton protects the brain, heart and lungs, and spinal cord, the appendicular skeleton helps us move. The appendicular skeleton is made up of the upper and lower limbs. We usually call them arms and legs. It's also made up of the girdles of these limbs. The girdles attach the limbs to the axial skeleton. All the bones in the appendicular skeleton help us move and allow us to manipulate our environment.
Also, bear in mind that when we're talking about the appendicular skeleton, we're talking about duplicates. The bones of the legs, arms, girdles all have duplicates on the other side of the body. This is known as bilateral symmetry.
Region 1, upper limbs.
One of the many important bones contained in the appendicular skeleton is the pectoral girdle. The pectoral girdle is also called the shoulder girdle. So remember, even though we're only describing one pectoral girdle, there are two in your body because you have two shoulders.
The pectoral girdle attaches the upper limb to the trunk of the body and also anchors muscles that move the limb. Each girdle is made up of two bones, the clavicle and the scapula. The clavicle, or collarbone, is the anterior bone. The scapula, or shoulder blade, is the posterior bone.
You have 30 bones in each upper limb, each one of them useful, each one of them special in its own way. Why, without the 27 bones of your hand, you'd never be able to play an exciting game of skee-ball. And without the humerus, the radius, and the ulna, you'd never be able to carry home those exciting prizes you won playing skee-ball. Exciting prizes like whoopee cushions and decorative magnets.
I don't play skee-ball.
Well, you should. It's exciting, but not half as exciting as an in-depth discussion of the bones in our upper limbs.
As we said before, each of your upper limbs contains 30 bones, broken down into three parts: the arm, the forearm, and the hand. And these three regions can be broken down into individual bones. So let us now take advantage of the knowledge and experience of our elders as we turn to the Old Person's Learning Annex to learn about bones in the upper limbs.
It's the Old Person's Learning Annex, where we learn from the wisdom of our elders.
They say that the upper arm contains one bone, the humerus. It is the largest and longest bone in the upper limbs. Well, I will tell you, I do not find a lot of humor in this bone. It is not a funny bone. It is not funny at all. You see, the knee, that is a funny bone. You get hit in the knee, and it goes, ugh, and you go, oi, and you kick, and it's a funny thing.
The upper arm contains only a single bone, the humerus, whereas the forearm contains the radius and the ulna. The proximal ends of the radius and ulna, that's the ends closer to the trunk of the body, those ends connect with the humerus to form the elbow. Their distal ends, you know, the ends further from the trunk, they connect with the hand to form the wrist.
And now, the Old Person's Learning Annex, where long-winded stories serve us well.
I remember when my son Herb broke all 27 bones in his hand. I remember it like it was yesterday. He was 4. He's 32 now, and he's an accountant. He's so very, very good. Herb was out playing carpenter with his cousin Murray. Anyway, Murray, being the cute little idiot that he is, he took a ball-peen hammer and smashed Herb's hand. That's right. He broke all 8 carpals, all 5 metacarpals. Those are the 5 long bones that form the palm, and he broke all 14 phalanges. That's the fingers in the thumb.
So the hand is made up of 8 carpals, 5 metacarpals, and 14 phalanges. The 8 carpals are the bones that form the wrist, where we put our watches and bracelets. The 5 metacarpals make up the palm, and the 14 phalanges give us our fingers and a pollex, which is a fancy word for thumb.
There's the shoulder girdle made up of the clavicle and scapula. And then there's the humerus, ulna, radius, 8 carpals, 5 metacarpals, 14 phalanges, and a whole lot of love.
And that's it for the upper limbs of the appendicular skeleton.
Region 2, lower limbs.
Now, some might argue that the body's lower limbs are more important than its upper limbs. These guys, for instance.
The lower limbs are far more important than the upper limbs.
No, they're not.
I'll cut you like a lion!
Well, regardless of which set of limbs is more important, the pelvic girdle is the cornerstone of all lower limbs. You probably know the pelvic girdle as the hip, but you probably don't know it personally, so let us explain. The pelvic girdle attaches the lower limbs to the trunk of the body. It's also a point of attachment for the muscles that move the lower limbs, and it even protects sensitive organs like the urinary bladder.
The pelvic girdle is made up of 2 bones called os coxae, which connect posteriorly with the sacrum and the coccyx. You remember the sacrum. It's a division of the vertebral column. Each os coxa is made up of 3 bones, the ilium, the pubis, and the ischium.
The ilium forms the major superior or upper section of the os coxa, or where you rest your hands on your hips when you're preparing for a big cowboy gunfight.
The pubis forms the anterior and inferior, or lower front, section.
And finally, the ischium forms the posterior and inferior portion of the os coxa. This ischium is the bone you sit on when you sit.
Now the pubic arch is the angle between two pubic bones. It is inferior to the pubic symphysis, a joint that connects the two pubic bones. But don't worry about joints now. We'll talk about them later.
The pubic arch can be used to identify a person's sex. This is because the angle of the pubic arch in males is less than 60 degrees, and the angle in females is greater than 80 degrees. The pubic arch has a wider range in females.
Now, all the pubic girdle details aside, let's discuss the lower limbs, dude.
The lower limbs each contain 29 bones.
That's a lot of bones!
The lower limbs support the entire weight of an erect body. They have to be much stronger than the upper limbs so we can use them for jumping, running, walking, and devastating karate moves.
The lower limbs are separated into 3 regions: the thigh, the leg, and the foot.
The only bone in the thigh is the femur, which is the largest, longest, and strongest bone in the body.
The leg is made up of the tibia or shin bone and the fibula. Only the tibia bears the weight of the body, which is transmitted from the femur to the foot. The proximal end of the tibia, or top part, articulates with the femur to form the knee joint, which is protected by the knee cap, or patella. The distal, or lower end of both the tibia and fibula connect with the foot to form the ankle.
Notice any similarities? The femur is like the humerus of the arm, both long, both durable. The tibia and fibula are like the lower limb versions of the radius and ulna, and the ankle is like the wrist.
Next up, the foot contains 26 bones in 3 different regions. Those regions are the tarsals, the metatarsals, and the phalanges.
The tarsals are 7 bones that form the ankle. The metatarsals are 5 bones that form the arch of the foot. Finally, the phalanges are 14 long bones that form the toes. There are 3 bones in each of the 4 little toes and 2 in the big toe, or some call it the hallux.
And that's it for the lower limbs.
Okay, now when we're looking at the bones of the upper extremities, right? Upper arm is humerus, forearm, ulna on the little finger side, radius on the thumb side, the wrist made up of the carpals, the hand is the metacarpals with 5 per hand, and the fingers are the phalanges with 14 per hand. And if we look at the bones of the hand and the wrist, what we see, okay, is a series of bones, all right, all articulated. Pull up, there we go. Okay. So again, right, you've got the carpals, the bones of the wrist, the metacarpals, the bones of the palm of the hand, and the phalanges, the bones of the fingers. Notice, all right, that the joint that forms between the carpals and the radius and the ulna is actually a condyloid joint, okay, which means that it can move in 2 planes, right? That's why you can flex, extend, and hyperextend your wrist, but you can also adduct and abduct your wrist, right? Adduct and abduct your wrist would be, you know, you can move your wrist to, you know, this would be adduct, tilted to that side in the plane of the body, and abduct would be the other direction, right? So adduct and abduct, okay, as well as flex and extend, and that would be in and out of the screen. So this is the front of the hand, so let's make this, make the arrow come at you. Kind of flow back. Okay. And shrink on that side, right? There's your arrow. So it's coming at you to flex, right? And coming away from you to extend and hyperextend, okay? So this would be flex Okay. Right, and then extend would be the other direction. Okay. The saddle joint here is unique, right? That's the saddle joint, right? And the reason that's important is because that lets the thumb do opposition, which means that the tip of the thumb can touch the tip of each of the fingers. Okay, so that's unique. There's two saddle joints in the body. One is between the carpal under the thumb and the metacarpal under the thumb, and the other is between the medial end of the clavicle and the manubrium of the sternum. Okay, the joints between the metacarpals and the fingers, phalanges, and between each phalange, those are also condyloid joints. Okay, those are also condyloid joints. Which means what? They can move in two planes, right? You can move your finger back and forth and side to side. Okay. So that's what a condyloid joint does, right? It's an oval protrusion in an oval depression. Okay. Gliding joints are between the carpals. Gliding. Okay. They sort of slide over each other. All right. And so that's your hand. Okay. All right. Notice that the phalanges of the thumb, there's only two of them, a proximal and a distal. And with all the remaining digits, there's a proximal, middle, and a distal. Okay. Pelvic girdle is made up of two coxal bones. And the parts of those coxal bones are the ischium, the ilium, and the pubis. Okay. Upper leg is the femur, the longest and strongest bone in the body. The lower leg, the patella, which is your kneecap. Okay. The tibia, which is the medial bone of the lower leg. And the fibula, which is the lateral bone of the lower leg. Okay. Upper leg, we generally refer to as the thigh. Okay. So, I mean, yeah, you can call it the upper leg, but technically we should use thigh to distinguish it from leg, which we always mean lower leg, right? The tarsals are the ankle bones. The metatarsals, the bones of the sole of the foot. And the phalanges are the toes. In this case, so you got two sets of phalanges. You got your toes and you got your fingers, right? So if you look here at the foot, right, you can see calcaneus is your heel bone, right? Then you've got the talus, which forms the ankle joint. Along with the fibula and the tibia. The tibia bears the weight of the body. Okay. And the fibula does not bear the weight of the body. So that's very important, right? And the reason is that the fibula does not articulate touch the femur, which is the thigh bone, right? You can see here the remaining tarsals, right? These are all tarsals here. They're all tarsals. These are metatarsals. Right? And then, of course, these are the phalanges. Okay. See superior view. The way to distinguish the talus from the calcaneus, the talus is smooth on top. So smooth superiorly. That's because that's participating in a joint, right? Calcaneus is rough on all surfaces because it's got attachment points for ligaments and tendons. Okay, there you go. One of the most important tendons in the body actually attaches to the calcaneus, and that's the Achilles tendon. And it attaches your gastrocnemius and your soleus to the heel of your foot so that you can pull up on your heel and point your toe. And that's called plantar flexion, right? The arches of the foot enable the foot to bear the weight while standing and provide leverage while walking. Medial to longitudinal is the highest. Then there's a lateral longitudinal and transverse. The condition pes planus means flat feet, okay, and can sometimes contribute to plantar fasciitis. Fasciitis. That might not be the right spelling. Don't hold me to that. That should be a C there. Fasciitis. I think it's here. Let's spell this correctly, shall we? Fasciitis. There you go. That's the correct spelling. So we've talked about the skeletal system, listed the functions, describe the structure, compact and cancellous bone, define the processes and the fascia associated with bones. And then we've talked about the two divisions of the skeletal system. What you've got to understand here, okay, is that this is a lot of material, all right? And it's going to take you some time to get all this in your head and be able to name the bones and the features and the articulations, right? So, I mean, we expect you to know what? The bone names. What the bones articulate with, meaning what joints do they form? Okay. And then their features. Okay. And for most of the bones of the skeleton, you want to be able to recognize the disarticulated bone. Meaning the bone by itself, not in the context of the skeleton. Okay. And then especially for the appendicular skeleton, you need to be able to distinguish right from left in a disarticulated bone. Okay. Now, not every bone, we won't take apart a hand or a foot. Okay. And there are certain bones that, are kind of tough, like the fibula. I won't ask right from left fibula. I just don't do that. But fair game would be things like a right or left femur, right or left tibia, right or left humerus, radius, ulna, right or left hand, right or left foot. Okay. Right or left rib, right? Right or left coxal bone, right or left scapula. Okay. Right or left clavicle. Those are fair game. Okay. So this takes practice. All right. You need to work with the articulated skeleton, and you need to take advantage of tutoring when we look at bones, and I give you clues about how to determine the articulations, the features, and the functions. Okay. So by all means, get in touch with me.